Hey, happy Sunday, everyone. I figured, so I was going through my mom's labs yesterday, and I realized as I was going through, I was like, I don't remember some of the stuff. I looked it up a long time ago and kind of understood what it meant, and then I thought that that this might be a good topic to go over with everyone else. Maybe you can tell me if you think, excuse me, that I'm doing something wrong, or maybe you can learn something from me. But essentially, I'm going to go through some labs, and I will tell you what I look for and try and explain what everything means. And essentially, what does it mean as far as like prognosis? What does it mean as far as risks that I think are present? So just trigger alert, I want to talk prognosis a little bit, not specifics, but there is some discussion as far as poor prognosis, good prognosis, things like that. So if you're not in the mood for that, no worries. But yeah, I thought this would be a good starting point for some dialogue so we can help each other read our labs a little more, with a little more experience and knowledge, and share our collective experience and advice. So I'll start with, this is a CBC, that's your complete blood count with differential. So it's going to say CBC Diff. That's, most people would get a complete blood count, CBC. But the differential breaks down your white blood cells further. So we'll see that later on. According to the oncologist, these labs are, quote, perfect for where we are in treatment. And she did give me permission to do this, but I'll try and keep it as generic as possible so that we're not diving into HIPAA and personally identifiable information and whatnot. But what I liked about this is essentially April of 2024 to now. You'll be able to see the weekly labs, or not in some cases. So this was, here's a gap here. So that was post-surgery. And then there's another gap. I forget why. She was like 2 weeks. But this was essentially weekly labs. And then started maintenance, so Lynparza. So this is 600 milligrams. And then, so you can see monthly labs here. Here's this gap right here where I said, gee, Mom, you haven't had labs in a while. Oh, yeah, I need to call them. And then, so, yeah, she wouldn't have had labs if we didn't catch it and tell them to schedule it. And so luckily we did that. Okay, so first and foremost in your CBC, and this is in the order that that when we pull up the my chart, that this is the order that it comes up in. So your white blood cells. Sorry, let me go back. Okay, so overall, okay, what are we trying to get out of this? The way that I search this, I would essentially, for a lot of these, this is going to be essentially just me Googling stuff. I do think Google AI is helpful as a starting point. Now, would I trust my life to it? No, but again, it's a starting point, and that's where our collective experience and our collective knowledge can help flesh out where some of the inaccuracies probably are in this. So first off, we want to get comfortable with using different prompts, and that's in your different search engines. So I even started to write down essentially what were some of the phrases that I would type in, and then I would just recycle these phrases. Okay, well, what does low white blood cell mean for ovarian cancer? And then you can tailor that. What is high if yours are high? So you would tailor that. What does low red blood cell mean for ovarian? So these are a number of the prompts that I used. In some cases, if I didn't know what something was, so what does corpuscular mean, right? So you'll see that. And then I think it's easy to start deep diving some of these, but without really getting that initial familiarization will know really like what is a platelet. I want to make sure that I'm not misunderstanding this from the get-go. So, hey, what is a platelet? So I tried to do that. And you'll see my technique kind of changed as I went through and did more. It did kind of morph as it should. The challenge is then to go back and just standardize everything, which I did not do. But again, you guys can help me fill in the gaps on that. In some cases, it talked about prognostic indicators, so I started to include that in some of them. It did get a little repetitive of like, this is, looking to be a prognostic indicator with such and such, CA125, whatever. So it did get a little repetitive, but not all of them had that. So I did write that where I saw it, so that maybe in the future I'll pay a little bit more attention to it. And there's, one metric in here that that I think I'm going to pay a little bit more attention to. I'm going to see if my mom can get labs done elsewhere, because her oncologist won't do vitamin D. And I know we were just talking about B12. I'll probably have her get B12 looked at, B12 and folate. And that's as a result of some of this, I'll say deep diving that I did yesterday. So get comfortable with using different prompts. And this is with AI, Google AI, or whatever. Start capturing, like I did, what some of your questions are so that you can start to standardize it. And in some cases, you might find a gold mine of like, I added ovarian cancer, I added prognosis in there. So as I started to look for different concepts, then I changed my prompts. If I can say the one thing would be, after all this, my takeaway is to get labs into normal range. I do intend to talk to family about getting labs done. And hopefully with a video like this, they can educate themselves on what all of that means and what some of the, I'll say the low normal, or what some of this are, what some of the results might be that they might at least keep an eye on it and be aware that there could be other issues. My perception is that for your CBC, it largely looks at anemia. So I associate that with your red blood cell, essentially anything related to your red blood cells, anemia, and then your immune function. So white blood cells, immune function, red blood cells, anemia, and oxygen getting to your tissues. Those are produced in your bone marrow. So after chemo, and in this case, Lynparza, it's going to stress your bone marrow. And so we'll probably get into how that can be detrimental to a fight with cancer if you still have cancer after all of this. Okay, so that's where I started to go, okay, what does high mean? What does low mean? So high white blood cell can signal leukemia, lymphoma, so you would want to keep an eye out for that. In some cases, it says for cancer treatment, it's monitored to gauge if chemo needs to be adjusted. So we all know that. Chemo targets fast-growing cells to include your white blood cells, and increases infection risk. Again, we all know this, but what it did say, high white blood cell count equals poor prognosis. So there we are with talking about prognosis of, okay, we want to get these, what do we need to do to get these back in normal range? In the case here, these are low. So we are at this point going to reduce from 600 to 450. And so I'm tracking now, like, well, what is the effect of that? So we'll see how that goes. And then if it's still not improving enough, then I'll probably look, I'll deep dive that a little bit further and see what else might be done to improve the white blood cell counts. Of note, I did want to highlight so I counted between the 11th and the 12th lab was when I'd made some changes. So I changed my mom's antiparasitics, and then she started taking beef liver pills, the organic beef liver supplements. And so I want to highlight, so this was where it was, and then she started taking it, and then we had labs done. So you'll see some increases of like, okay, within this time period. So when I recommend like these organic beef liver pills, like this is it, is like across most of her labs, you can see a jump just within that short time. And again, you can see all the previous times where there's not really a jump like that, especially for your red blood cells. Then she had chemo, so it dropped, and then it came back. And then she had chemo and it dropped. But my perception is that it helped her recover faster. Where before she wasn't recovering, it was just kind of a downward slope. And then with this, she was able to recover some. And then once she was finishing chemo, then she was within normal. This is one example, again, where Lynparza has just been more toxic than Frontline in that we're still below normal. Now it's kind of holding steady, and it's, okay, 3.5-ish versus 4. So I'm not freaking out too much. The oncologist says this is fine. But this is one area where what was somewhat working to improve between chemos, we just don't have that break with daily pills. So the internet says low counts are associated with cancer treatment and or cancer itself. Okay, we know that. Causes fatigue. That has to do with whether or not your tissues are getting enough oxygen. And there are a variety of ways and different tests that they figure out where in that process of breathing to tissues getting oxygen, where is that breaking down? And like all things, it's a complex system, they're interrelated, but we don't have to be rocket scientists to somewhat understand generally how this is supposed to work, and then to understand that there are things that we can do to help ourselves. Says specifically, carbotaxol destroys rapidly growing cells, including cells in the bone marrow, responsible for red blood cell production. And yes, the beef liver pills, she started taking them between the 11th and 12th lab. So I started circling those. I started making weird lines. So hopefully that's not too distracting. Okay, so those are number 1 and number 2. Okay, let's see. Hemoglobin. So the hemoglobin, that is a protein. So like, what is it? Right? Protein in red blood cells that carry oxygen to all the tissues in the body. So again, here I have my like frontline and maintenance line. Here's another of these jumps where, again, within 1 week, her labs jumped. You see it jumped. So low hemoglobin. And again, this is where I'm happy with it. Okay, so red blood cells are down. That to me is indicating that it's still stressing the bone marrow. But as far as like, okay, how are the red blood cells doing? And the protein itself is not an issue, right? So of the red blood cells, she has the protein to carry the oxygen. So this is one area where I am satisfied, again, with the beef liver pills. I think this is making a meaningful difference for her. So you can see she went up, and then chemo dropped it down, and she rebounded, and it started to come up. And then more chemo, and then let's see, 1 chemo, 2 chemo. This would have been yeah, so that's right. She had 2 delays in there. So by her 6th chemo, right, she was within normal and stayed normal. Again, even with chemo, it was enough to help that metric improve. Same with here, before we finish. So low hemoglobin is associated with poor treatment response, decreased overall survival, and more aggressive disease. So that to me, God, it still just gives me goosebumps. Like, okay, I'm glad we did something about that. Now, is that going to make any difference long term? I have no idea. But control what you can't control, and we can control this, and we're doing something about it. And it's meaningful to see the labs respond in that way. It says low levels during chemo. Oops, I can't. During chemo indicate worse outcomes. It's associated with, it has an IL-6 inflammation association. So that's some of the like cell signaling type, cellular biology type lingo. I'm not good at that at all. I started to like, well, I tried looking at it a while back and it was still just kind of Greek to me. So maybe somebody can talk to me about IL-6 because that comes up once or twice in here. Okay, so hematocrit, HCT, that's the percentage of your blood that is red blood cells compared to plasma. So basically, do you have enough, I want to say volume. And again, so she started taking it right after, right here. Let's see, and it's still generally, I'll say good enough. So she's got enough within the blood volume. The internet says low hematocrit indicates stage 3 to stage 4. So like, okay, as I'm looking at like, okay, when she first started, she still wasn't great. Low hematocrit, i.e. anemia, is again associated with worse outcomes, worse response to chemo and survival. So obviously, like if you're not responding to chemo, then that of course means survival is going to be more challenging. Low hematocrit is associated with tissue hypoxia. So again, going back to this, like all of your tissues need oxygen as part of normal metabolism. So if they're not getting it, then everything's going to be stressed. Okay, let's see. MCV, mean corpuscular volume. So that's what I was like, what is corpuscular? What does that even mean? Corpuscular, relating to or composed of corpuscles. Am I saying that right? Which are minute particles or small independent bodies, especially cells like red blood cells. Now this is where I kind of was getting a little confused where, okay, it says the mean corpuscular volume. Well, mean mathematically is like your halfway point of all of the data. So if you line up all of the data, halfway point, this is your mean corpuscular volume. But then the internet says it measures the average size of your red blood cells. So if you have an average and you just take all the numbers and divide, okay, well, that's average, but averages can be challenging. If you have something other than standard deviation, that's going to skew your numbers. So like if you look at, well, the average income in America is, $60,000 per person. Well, but you've got 1% of the population that makes, $50 billion each, right? They're, in that case, right, your billionaires are over here and their average is going, their income is going to skew the average versus if you were to take mean income. So what is the exact middle point of all the data? What is the exact middle point of income? You might find that the mean income is, 45,000 per person or something like that. So, I don't understand how you can have both. Mean corpuscular volume is the average size, so that doesn't make sense. Those are contradictory to me. But okay, I generally understand average size of the red blood cells. Okay. What that means is too small. If your red blood cells are too small, it means you might have an iron deficiency. Obviously, that's not the problem here. Too large means B12 or folate deficiency, liver disease, or heavy alcohol use. Indicates chronic chemotherapy use. Okay, so like obviously this doesn't apply. This but maybe B12 and folate need to be looked at. So I've asked her to get on her primary care's schedule to see about getting some of those vitamins looked at. It says chemo disrupts the production of red blood cells, leading to larger, less efficient blood cells. Loss of appetite, nausea can result in nutritional deficiency, so that relates to the B12 and the folate deficiency. I think in this particular case, the disrupts the production, leading to larger, less effective. There's also the red blood cell itself during its lifetime will, I think when it's a younger red blood cell, it's bigger, and then as it starts to age, it gets smaller. So basically, she's got a lot of new red blood cells that are bigger. But because they die more frequently with the Lynparza, then her body is working hard to continue to make new blood cells. That's how I interpret this, at least. This is not medical advice, so maybe I'm wrong. Please tell me if I'm wrong. Okay, MCH, mean corpuscular hemoglobin. So again, corpuscular, corpuscular is generally relates to red blood cells. Okay, so measures the hemoglobin weight in each red blood cell. So that's a pretty, trying to picture the equipment that would do that. But let's see. So you can see, okay, here's Frontline. Started beef liver pills. So it's still kind of an upward trajectory. So I'm not entirely sure if I can make that statement, but I just figure I'd keep putting that out just so you can see. And that's standardized across here. Like when did this start? So your MCH, mean corpuscular hemoglobin, high is a sign of macrocytic anemia. RBCs are trigger and carry more oxygen. Oh, so are bigger. I can't read my own writing. RBCs are bigger and carry more oxygen. So that's a little conflicting with what it was just saying before, and that they're less efficient. So I'm not entirely sure. Except that, okay, she's generally high, but not too high. I would say stabilized. So over this period of time, stabilized. Most often a sign of B12 or folate, liver disease, deficiency. Oh, the internet did say folic acid. So I want to highlight like the difference. Like folic acid still has to be metabolized by the body. So like it really bothers me. It just drives me insane that like all of our bread products are fortified with folic acid. Great. That doesn't help. You can have people that are essentially overloaded on folic acid and they're not able to break it down into folate, which is what they need. So for anybody taking vitamins, like you want folate, not folic acid. Now, if you're folate 1 receptor positive, like my mother is, then she doesn't get any folate if we can avoid it. I mean, there's some in the bread products that she eats. So like some of it's just unavoidable. But yeah, I just want to highlight the difference. Like the internet told me folic acid. That's not entirely true. You want to look at folate. That is true for pregnancy as well. So that's when I started deep diving vitamins when I was pregnant, that came up. So we're talking 10 years later now, and I still get mad about everything having folic acid being added to it. In principle, I should be able to withdraw consent and not have it, but I just saw an article that they're going to add folic acid to tortillas, corn tortillas now, because somebody somewhere decided that Latino women need more folic acid. So now all of us that eat corn tortillas are going to get folic acid. Like it's just oppressive. Anyways. Okay, let's see. Okay. Mean corpuscular hemoglobin concentration. Average concentration within a given volume of red blood cells. Let's see. So iron deficiency, chronic disease can point to, so low levels can point to anemia. It can be treatment side effect. So all of these things. Let's see. This one doesn't really show, but hey, it's normal, so it's good. Red cell distribution width, RDW. So this is red blood cells width and variation in size. So essentially you want to have like, right, if the blood cells change size, essentially in accordance with how old they are, then you want to have like a good mix of each to show that we're regenerating them and that the old ones are dying and that cycle is good. Here again, that's when she started beef liver pills. I don't know what would account for this other than like if she started, it was going on a crazy trajectory and then tanked after she started taking them and then stabilized. So here's a higher RDW is associated with more advanced cancer stages and worse overall survival and progression-free survival. So this is where I want to maybe revisit this. Researchers are exploring RDW as a combination with CA-125 to help diagnose ovarian cancer and or predict the behavior of the cancer. So essentially who's going to respond, who's going to however, so all that, they're looking at it, but they said results are inconsistent. So it's not gospel. I'm I'm inclined to just wait for them to figure it out, except that, again, if I can do something to get them back into the normal range, then to me that's worth the effort. Okay, platelet count. Tiny colorless blood cell fragments made in your bone marrow that stick together and form clots. They plug damaged blood vessels. So this is where elevated platelets. So when I read elevated, I mean like off above the 400. Indicates aggressive disease, risk for blood clots. If your platelets are too low, then you're looking to have taxane-based chemos reduced. So this is a metric for that. And then high platelets, again, are associated with reduced survival. So anti-IL-6. So there's that IL-6 again. Anti-IL-6 antibodies target platelets directly. They may rise with reoccurrence, even if other markers are normal. So this is where, like, really might rise with reoccurrence. So is that like Natera, where you kind of see some of the precursors before your CA-125 jumps? Or in some cases, I know ladies who have had essentially a pretty stagnant CA-125 and still recurred. So for them, CA-125 wasn't helpful or accurate. So would this be something to keep track of, either in addition to CA-125 or as a standalone, or maybe with a Natera test or an HE4? Okay, so for platelets specifically, because of the association with platelets and metastasizing cancer, like mom's been on baby aspirin for months and months now. Essentially, the theory behind it, right? Because cancer would essentially spread, so to speak, through your two channels. That's your blood circulation and then your lymph system, right? So you have two circulatory systems. We always talk about blood. We never talk about lymph nodes. Lymph nodes will come up later, but in the case of blood, when this is elevated, then cancers essentially stick to it, and that helps them set up new sites elsewhere. So from metastasizing, you don't want sticky blood, so that your immune system can clean up some of these free radicals that are floating around, these circulating tumor cells. Your immune system has a chance to clean them up before they take root. Okay. Low platelets, it says temporary side effect of chemo due to bone marrow being affected. Of course, I'm going to cough now. Okay, so platelets, you don't want them high. These are, again, stabilized. I don't worry too much about them. You can see they dip down during chemo a couple times and have since recovered. Now, this was, again, 11 to 12. So I don't know if that's any correlation with the with the beef liver pills, but yeah, like the 11 to 12th lab was a dip there. I don't know. That might be related to something else that we'll talk about later. But okay, let's see. Mean platelet volume measures the average size of the platelets. So again, these are tiny colorless blood cell fragments. Okay, now we want to make sure that they're tiny. So there's normal. Here's, again, another, I don't know what that means, if it means anything at all, but that was just when she started the beef liver pills. The other piece of that is I'd also changed her antiparasitics. I had this, like a trio. It was 3 antiparasitics from Happy Healing that I'd put her on, and you'll see her liver labs jumped up. So that might be related to that. I don't know. But those were the two major things that we changed in that time period. Let's see. Large platelets mean that they are newer and more active and can be associated with inflammation and cancer progression. So I guess, again, you don't want this huge, you don't want high numbers. However, some research says lower mean platelet volume. Oops. Mean platelet volume. Mean platelet volume. Predicts poor survival, indicating bone marrow stress or older, less functional platelets. So again, keep it in the middle. You know, you don't want it too low, you don't want it too high. Here's another prognostic biomarker potential being studied, so who knows, to help assess how aggressive OC is or how well a patient responds to treatment. Trends for OC specifically are not clear. Some indicators say that low mean platelet volume has worse survival and potentially chemo resistance. I don't know of anybody in particular right now that fits that. So if that sounds familiar, like, you know, help us fill in some of these gaps. If that's hopefully not you. Hopefully we're not chemo resistant, but it obviously happens a lot. Okay, now we're into the white blood cells. I guess we're kind of back in, yeah, I guess platelets are still not, okay. So I guess blood. Neutrophils, most common type of white blood cell. It's considered a first responder to infection. It engulfs and destroys pathogens through phagocytosis. I started this one. This fights tumors, but gets reprogrammed by the tumor microenvironment to support cancer growth. This is the one where the DNA theory, somatic mutation just drives me insane. Like, what causes these to get reprogrammed? There is no DNA explanation for this predictable occurrence within cancer, where the tumor essentially recruits your immune system and uses it against you. And as I'm reading Mark Lintern's book on fungal infections, and you start understanding how can a fungus reprogram the host and influence behavior, it is at the very least possible. Again, I go back to the Amazon ant, that the behavior is influenced so much so that the ant departs the colony, goes towards water, and then dies, so that the fungus can then protrude out of its head and release spores into the water to be ingested by some other poor creature. But as far as like hijacking the host and making it do stuff, that's fungal. Certainly parasitic. I know some of us have talked about Lyme disease, and Rebecca just mentioned recently, like with Lyme rage, and how some of these pathogens can affect your mental health status in a pretty significant way. So when I see stuff like this, like getting reprogrammed, like that to me is parasitic. Now, whether it's fungal or protozoan or whatever, I don't have a magic ball, crystal ball to know that exactly, but it's still terrifying to read, and I guess needs to be taken seriously. So essentially, the internet says high neutrophils are associated with lower survival. And that is, I interpret that as high neutrophils are essentially the neutrophils that have been reprogrammed. So why would high neutrophils equal, if they engulf and destroy pathogens, that to me, if high neutrophils are with lower survival, that means those neutrophils have all been compromised and are supporting the tumor. Those are called tumor-associated neutrophils. So again, like that, I don't know. I want to say it's terrifying. I don't want to be a Debbie Downer. But this is just, I would say, fascinating and terrible. But the only way to move forward is to learn about it. So that's just where we are. We can't stop here. We just got to keep going so we can learn about it. It can also activate T cells and produce, what is ROS, reverse oxygen species, or ROS, I forget. Drawing a blank. Okay, low neutrophils are common for chemo. She's in the middle, so that's good. All right, lymphocytes. Critical immune cell. These are your T cells, B cells, natural killer cells. This is what that one video was talking about. Like, why are we not looking at lymphocytes? This oncology system has never discussed lymphocytes, never talked about it, never. These are the cancer-fighting soldiers. So, like, whatever we need to do to get our lymphocytes to be healthy and working for us is, to me, incredibly important. These are, according to the internet, your cancer-fighting soldiers. They signal cancer if they're high, as in lymphoma, potentially, or they can indicate treatment effectiveness. High counts may indicate leukemia. Okay, we know that. Low counts may suggest weak immune system and less favorable outlook. I just want to point out, like, there was a bug that went through my house. This was right after I told everyone, like, oh, my mom never gets sick. Well, then she got sick for 3 days. And then my dad got sick, and it was just a big mess. They're fine now. I mean, the numbers are fine now. But, yeah, like, it was 3 days, and then, you know, it was one at a time. So I'm, you know, caregiver again. Yeah, that was hard. But it's over. And let's see. So T cells, they recognize and kill cancer cells directly. B cells, I think these are like B lymphocyte cells. B cells produce antibodies to mark invaders like cancer for destruction. Natural killer cells find and kill infected or tumor cells. So you would look for a neutrophil to lymphocyte ratio. I wanted to try this. This was the example that it gave. So a high NLR, high neutrophil lymphocyte ratio, equals lower overall survival and progression-free survival. So I say do the math. This is the example they gave. Now, this is the problem with percentages. It's not going to work with percentages. You need actual numbers. So that won't work here. But like the primary care provider, those labs are all in the actual numbers. So if I were to get those numbers, I would be able to do the math and just, I'll say just for curiosity's sake, again, I'm not too worried about this, but again, if you wanted to look into it, that would be one thing to do. Okay, monocytes, largest white blood cell produced in the bone marrow, turns into macrophages or dendritic cells. I'm not sure what dendritic cells are. Fight infection, clear dead cells. They regulate immune responses. Okay, so they can help the cancer to become pro-tumor. They can have pro-tumor macrophages known as TAMs. They can help metastasis. They can suppress immunity. So these are another one that's like, oh gosh, like when I say know your enemy and you're at war, like this is what I have in mind. It's like you're at war with your own immune system. Like, how did it get hijacked, and then how do you get it back? Infection and inflammation, autoimmune disease, some cancer is if it's really high, okay, if it's really low, suppressed production, immune system disorder, etc. Google says higher monocytes are associated with recurrence. Maybe. So I don't know if anyone else has seen that. Chemo can increase pro-tumor monocytes and reduce treatment efficacy. Sure. Let's see. I had to look this one. Eosinophils. I think I actually wrote that out later because I was saying it wrong. I don't always look them up. If I just read a word, sometimes I just move on. But okay, that's the type of immune cell that helps fight infection, especially parasites. Plays a key role in allergic responses and asthma. They release toxic proteins and free radicals to kill parasites and fungus, largely found in connective tissues, lungs, and gut. So this one was interesting to me so sometimes favorable for cancer, breast and prostate. So that to me, okay, ovarian, I put ovarian in those categories. High levels signal some blood cancers or solid tumors like ovarian. That's not the case for us, but like you're saying, it's going to release proteins to kill parasites and fungus, and high levels are associated with solid tumors like lung cancer and ovarian. And they don't typically reside in, I'll say, the reproductive tract. So this goes back to, okay, parasites and fungus, again, like, as far as like, where are these captured? If you had an imbalance, I'll say a bacterial, protozoan, or fungal imbalance in your reproductive tract, how would you know, and how would your body handle it? And if the primary means of doing that is in your digestive tract and your lungs, then in theory, these invaders would go quite a while unnoticed. It's a potential biomarker for treatment response, and it is part of an immune response for candida. So if you have a candida infection in your gut, then you would, in theory, see your eosinophils. You would see that in your lab work. So back to the lintern and the macus, like, what is cancer? And the answer is, it's not as simple as a bad luck, bad DNA situation. There's a lot going on there in the ecosystem of your body, and we know so little about it. Nor does any of that show up on scans. As far as like the parasite and the fungus thing, like from when they take and biopsy the tumor, what I don't understand about the fungus component for ovarian specifically is, like, they biopsy, would they not see the fungus, or do they not look for it, or is it too small? Like, what might that look like? How would you observe it from a medical professional standpoint? I don't have that answer. But okay, basophils, they release histamine and other chemicals during allergic reaction, inflammation, and against parasites, to include worms, bacteria, virus, and fungi. So again, this is a now, I don't know if the lab changed. Like, why did she just go from 1 to this bouncing around number? So this to me is a difference in lab technique. But beyond that, okay, it's normal. Potential biomarker, again, function is not clear cut. So this is here, like, Google doesn't know exactly what the function of basophils are. Sometimes it can help the tumor grow, and other times it can fight it. So we just don't know enough about it. But again, bacteria, fungi, worms, bacteria, virus, and fungi. So I would say, like, if you have high numbers, then you probably need to be on some heavy-hitting antiparasitics. ANC, we know this. If your ANC is too low, then you don't get chemo and you got to come back a week later. So that's ANC, total number of neutrophils in your blood. Critical safety parameter during treatment. We know that. Possible prognostic marker for disease aggressiveness and survival. Elevated ANC is a sign of inflammation response to the tumor. Higher NLR. Remember that? NLR. What was NLR? I forgot. Neutrophil to lymphocyte ratio. That's where it was. NLR. Okay. So higher neutrophil to lymphocyte ratios are associated with advanced, high-grade, and aggressive ovarian cancer. That's not elevated to me, so I don't know that applied to us, except that, well, since then it's been low. Okay. Let's see. Low ANC is infection risk. Low counts show improved tumor response to treatment. So that's good. Neutrophil, extracellular traps. So that's where in the oment. Oh, so your neutrophils, as far as like, well, how does it help for ovarian cancer? How does it help the cancer? And it can create these neutrophil extracellular traps, so essentially little clumps in the omentum, and those are associated with the metastasis. So everyone has their omentum removed during the hysterectomy, and that's I believe that's because neutrophils have allowed for the cancer to invade the omentum through these NETs, the neutrophil extracellular traps. Your ALC, the precise number of lymphocytes. Low ALC equals poor outcome, overall survival, and progression-free survival. And that's from any cause. So it's not just ovarian cancer, but hey, if you have really low numbers, so like, well, maybe, okay, well, these are stable. Do we need to do anything? What can we do? Okay, there was a study that came out that was titled "Absolute Lymph Count is Associated with Survival in OC." That was in PubMed from 2012, and that was Milne, M-I-L-N-E, and a host of other, probably another dozen researchers. But that might be worth looking up. It says values decline in proportion to the disease burden. It might increase following surgery. So I counted. So here's surgery, and then here's the beef liver pill. So I didn't really see that, but it was already low. So I don't know. Is that a good thing? low, but not too low, right? It wasn't still within quote unquote normal limits. They're also looking, so this Milne study talked about tumor infiltrating lymphocytes, and CD8 equals prolonged survival and progression-free survival. So from a lab standpoint, and like, where are you? Like, if you can get labs, I don't know where you would get CD8 done, but I would be interested in that. Absolute monocyte counts, total number of monocytes. Elevated AMC is associated with worse outcomes, suggests aggressive tumor environment, and weak anti-tumor immune response associated with tumor invasion and lymph node metastasis. So this is where now we're talking lymph rather than blood. All right, the highway, it's the circulatory system that nobody talks about, is the lymph system. Let's see, low AMC is also poor prognosis. So just be in the middle. Lymphocyte to monocyte ratio, the LMR, means fewer monocytes compared to lymphocytes equals shorter overall survival, progression-free. So again, if you want to do that, you can. I did not. Low count suggests immune suppression and can also be a side effect of chemo. Hers are fine, so I don't worry about it. Absolute here's their eosinophil. Eosinophil measures total number of eosinophils. Thank you. Okay, well, sometimes it's 0. I did look that up, and it said sometimes it's just lab equipment that just can't tell. And remember, the eosinophils are in the gut, and then for that particular blood sample, it might not be concentrated in there. I mean, if they were to take a volume of blood from your gut, then they would probably have more. Absolute basophil count. Several studies suggest higher basophil counts are associated with, now clinically insignificant. So, all right, so the fact that it's 0, here's another one of those technical limitations of like, well, 0 is a common finding. It's a technical limitation, automated lab analyzers rather than the true absence of cells. So thanks. Who knows what the actual value is. However, persistently low basophils may be associated with lower prognosis. So still not an independent predictive role for ovarian cancer, but something that in my free time I'll want to look into further. And then as far as this uptick and then downtick, what does that mean? This is before chemo. So before chemo, this is right around when chemo started. So what is that? I don't know. I can tell you in that time, all right, that was the, let's see, the sinus was drained, and we also started a bunch of stuff at the house. So I don't know. So like I said, get your labs in normal range, whatever you can do. Purpose of the CBC Diff is to look at your white blood cells and immune function, red blood cells, and organ health and anemia. Talk to your family about understanding labs. Get comfortable with using different prompts as you look these up yourself. Invariably, you're going to have different questions. And this is, of course, not the whole picture. You're going to want to look at other labs. So we have to do that through primary care. So what we're looking at from this is reevaluate vitamin D, B12, folate. Is there a generic nutritional panel? Can I just get all of the vitamins? I just want to see all the vitamins. Now this is largely from, there's a book called Drug Muggers that talks about how different medications can have different loads and cause nutritional deficiencies. So what stood out to me here, I was going to read this book for my dad who started some type of blood pressure medication. But one of the opening chapters talked about how birth control causes a zinc deficiency. It's well, wow, I felt that when I was on it. I haven't been on birth control in years, but I remember that. And then my corresponding disappointment, well, why didn't any of the medical providers that had given me birth control and given me the prescription, no one had talked to me about, hey, maybe you should supplement with zinc while you're on this. And that to me is where that's the genesis of the beef liver pills. It's okay, you're just going to let all of these labs dip down and all the fatigue and all the risk for either leukemia or anemia. You're when you're doing something that causes stress to the body, why don't you give it what it needs? And again, everyone's scared. Oh, you don't want to feed cancer. I got it. We don't want to feed cancer. That's absolutely true. But like, there's got to be some middle ground, and let's be smart about this. Okay, so last CMP. This is going to be hopefully quicker than the other one. So CMP, your comprehensive metabolic panel. Again, so these numbers are just part of the whole picture. So the first grouping is electrolytes based. And I'm of the opinion at this point that like electrolytes are this, I guess, new thing for me. I'm starting to understand the blood and the heart differently as it relates to electrical impulses and energy. And like, I no longer see the heart simply as a pump. And the way it was described to me is like, what type of pump, when you look at like the miles and miles of capillaries and the requirement for essentially like bumper to bumper traffic of individual red blood cells traversing through the miles and miles of capillaries. Like if you were to require a physical mechanical pump for that, like your heart simply is not capable of doing that. Other descriptions, and this was actually off of a Joe Rogan episode, I think, where they talked about the heart as a vortex, and it essentially utilizes positive and negative charges. So picture, are you familiar with like this high-speed trains? Like that's magnetic levitation, where there's no parts are touching, and they're using magnets to shift things and move things in accordance with their properties. And so when I look at electrolytes and negative and positive charges of things, I'm now looking at the blood and the heart of like, this is a system of electricity where we're using positive and negative charges to move things around. And then even within the blood and the plasma, understanding that like if we were to drink water, just straight water, it's not going to have the nutritional balance that your body needs so that your cells can absorb it. So you have to add electrolytes to it so that your cells can then metabolize it. So that essentially it can enter the cell and then be used. But just to drink a lot of tap water doesn't equate to you being hydrated. If your cells are not able to do it and you're still causing your body to have this load to make it digestible, metabolizable, and then also the load on the kidneys because that affects pH. So there seems to be this balance of pH with electrical charge that I find interesting, and I feel like I'm just scratching the surface on it. So just know, like when you hear electrolytes, don't think Gatorade with sugar, because that's absolutely not part of the picture. Electrolytes, according to the internet, are sodium, chlorine, magnesium, calcium, and potassium. Again, not Gatorade, not sugar, not any of that crap. But these are essential minerals that carry an electric charge when dissolved in the body fluids like blood. They regulate nerve and muscle function, maintain fluid balance, and support acid-base, so your pH levels. So pretty important. And again, like I generically understand chemo as affecting your electrolytes, but beyond that, I don't honestly have a solid understanding of exactly when and how, and except that through observation of side effects and then trying to supplement smartly with that. So sodium is, let's see, part of electrolytes. Their most common electrolyte. This is the most common electrolyte abnormality in patients. I don't see that. Maybe we have a lot of salt. I do a lot of salt in my house. I no longer believe in the evils of salt. I think good salt is good. So not necessarily the iodized salt, but I do a lot of the Himalayan salt and the Celtic sea salt. To the point where if I have like water from my reverse osmosis filter, I'll add salt to that just to give it something, because the RO will actually take out everything from it, and I want to have some electrolytes added into it. electrolytes, in this case being sodium and some of the other minerals that are part of Himalayan salt. Let's see. Abnormally low can reflect a tumor's activity. It can upregulate sodium transporting proteins, causing them to absorb more salt or more sodium from the bloodstream. So I'm picturing this as, is sodium another like feeding pathway that can be monitored? I don't know how you would block it, but it contributes to tumor. So like abnormally low is essentially associated with tumor invasion and possibly progression. So is that specific for OC? I'm not entirely sure. I don't know if anyone has experienced that. Let's see. So low sodium is considered a negative prognostic factor. So I don't know. Let's see. Yeah, if I ever get cancer and the tumor is feeding on salt, then I'm a goner. But let's see. Potassium, used to assess electrolyte balance, general health, and kidney function. I believe chemo, at least Frontline, can drain potassium to the point where my mom was on, she's still on a prescription potassium pill. That's not important to cancer, apparently, so that's through her primary care, not the oncologist. But important for general health, kidney function, those are important to us, and her primary care gives her the prescription. You can get it over the counter, but it was in tiny doses, so to get 100% potassium in one day, you'd have to take like 10 pills, and that was just silly. So she got a prescription, so she has to take 2 or 3 pills. So ovarian cancer treatment can lead to electrolyte disturbances. So we want to monitor that and try and compensate for that load on the body that we know is coming, and try and help your body right itself. Chloride, I didn't actually know anything about chloride until I did any of this. So if I'm doing any of this wrong, just tell me. So chloride apparently works with sodium potassium to help control the amount of fluid in the body and maintain a healthy pH. Kidneys play a major role in regulating chloride levels. I associate kidneys with maintaining pH anyways and maintaining healthy fluid levels. So maybe this is an important mineral that the kidneys use. So that makes sense to me. Abnormal chloride levels indicate potentially dehydration, kidney disease, heart failure, acidosis, or alkalosis. Glucose. Elevated glucose levels are a significant prognostic factor. It didn't give me more than that, and by this point, I mean, I was sitting on my phone Googling all this all freaking day yesterday, so you can see I'm kind of running out of gas here, but maybe someone else can tell me exactly why, except that, well, and I know how controversial this is in the other groups, but hey, if your cancer eats sugar and you eat a lot of sugar, then you're feeding your cancer. And I know that's, pretty controversial in the other groups, less so in ours. But I just wanted to point out, Mom was doing well. Day after surgery, skyrocketed sugar. It's because all the crap they give her in the hospital. All the drink this and drink that, and day after surgery in the hospital was her worst day of sugar. And then what I have is another box of all of the pre-surgery crap that they gave her, loaded with sugar. Oh, this has vitamins in it. It's 5% zinc. How can you say it has vitamins in it when it's 5%? It's what it is. It was a sugar drink. More sugar, 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 sugar. It just boggles my mind. These people are in charge of our health, and they have these products and assign you to ingest these products before surgery like this. So Google says that your liver produces glucose between 3 and 8 a.m. as part of your circadian rhythm. Mom does eat breakfast, so this isn't too, and this to me says that she had labs in the morning after she ate breakfast, so that's what I associate that with. She did also stop metformin. She was getting horrendous leg cramps. So the metformin supposedly has a drain on, I think, potassium. I don't know, but she stopped the metformin. The leg cramps went out. It was to the point, it was waking her up all night, so we had to stop the metformin. And then she's since stopped the berberine because she's trying to put weight on. So we actually, how do you gain weight? Well, you eat carbs and sugar. So she's putting on weight little by little. So So we're going to continue this because this is what she needs right now. And then once she reaches the weight that she wants, then we'll change it again. Okay, your BUN, blood, urea, nitrogen. That's a waste product from protein breakdown within the liver. It's an indicator of kidney function. High levels indicate poor kidney filtration, dehydration, or high protein intake. Well, we do eat a lot of steak at my house, so high protein, maybe. I'm thinking it's maybe an indicator of kidney filtration in that moment. You can see it bounces up and down. I am curious if this is related. I know Avastin is hard on the Avastin is hard on the kidneys. So are these spikes from the Avastin? Maybe, I don't know. Because she got 2, then didn't, and then got 2 more. So here's the break for surgery in there. But yeah, Lynparza has been toxic as far as like what I say as the trend goes, she's back down to normal. So I associate this with like she's adjusting to the Lynparza and it's kind of evening out. But I'm not entirely sure. Now here's where you'll see a couple jumps. This is when I said I changed for antiparasitics. So your creatinine monitors kidney function again. Low creatinine can indicate cachexia. Use creatinine to calculate GFR. So your how do you say that? Glomerular filtration rate. So again, how well are your kidneys functioning from a filtration standpoint? So they can use this to adjust chemo doses as well. So I changed her antiparasitic and her labs shot up. We're like, whoa, good. Oh, geez. So we obviously had to make some adjustments and they popped right back down. So during that time, okay, I paused her for a week on the antiparasitics and then changed the dose and she was fine. So that was, I think it was the trio from Happy Healing. Added that one in. And that was 3 antiparasitics in 1. And so changed that. And then we also split it into like halves. So it's like one big pill. So we split it. So it'd be an AM and PM versus just once a day. We also were not good with serapeptase. So we've since added serapeptase and you can see we haven't had any more spikes of things. Let's see. Calcium. Let's see. Chemo can drop calcium levels. What was that book? What was it? Ovarian Cancer, My Walk with It. There's this lady's firsthand account where like she lost teeth. And there was another post in the Normie group recently of like people, like women are losing teeth from chemo. And I'm associating that with like, I would want to see what their calcium looks like. And again, from like, okay, if you know this is going to drain you of calcium in some way, then what are we doing about it, right? Like, we're just going to like push people over a cliff until they lose all their teeth. And I'm like, oh, maybe we should have supplemented with calcium. I'm like, why are we not talking about this from the beginning and helping people prevent some of these? Poor vitamin D levels and magnesium levels can also contribute to this. So again, this is one metric, but they're interrelated. It can also be monitored for inflammation from treatment. Let's see, total protein, that assesses the nutritional status of liver, kidney function, and the body's ability to fight infection. So she's fine on that. How well, let's see, total bilirubin. How well the liver is processing bilirubin, which is a byproduct of red blood cell breakdown. So again, we know the red blood cells are going to get damaged from the chemo, and it's linked to low hematocrit, of course, as well. So this is where, so she started low, and now she's higher. And you know what? Here, let's count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So 11 to 12. So this is where she started, right? So right here is the beef liver pills. Okay. Beef liver pills plus chemos plus Lynparza. Let's see. No, she didn't have 4 chemos. She had 3. So I'm not sure what those drops are. Why are there 4 drops? But yeah, here's Lynparza. But hey, I'm happy with that. And actually, no, I did see kind of this, like, I don't understand what is causing it to be up and down like that. We really haven't, I don't feel like we've changed that much, but hey, it's in the normal. I'm happy with it. Okay, albumin, nutritional status, inflammation, overall health, low levels signal worse nutrition, severe inflammation, cachexia, higher risk of complications like infections and possibly poor response or tolerance to treatment. Okay, again, she's fine, so don't worry about that. The other one that's not in here, that's not printed, is your glomerular filtration rate. That's basically less than 60. No, I actually looked that up. 30 to 60 if you're... Now, your labs won't show this, but you want less than 30 as far as like... But less than 60... So if you're above 60 is moderate. Moderate kidney filtration issues or whatever, like kidney stress. So 30 to 60 is a little bit of kidney stress, and then less than 30 is what you would want. I looked that up a long time ago. If I'm wrong, please tell me. Another one that was important for us was vitamin D. Normal, quote unquote normal, is 30 to 100. Dr. Paul Merrick talks about vitamin D in his Cancer Care first and second edition. So we've paid attention to this. You want, as a cancer patient, right, 30 is too low. Like if you are fighting cancer, you're a cancer patient, you want 90 to 100. There's even discussion of like going above that. And you can just Google like, who's died of a vitamin D overdose? And the answer is, according to the internet, which is always true, one person died and their numbers were in the like 300s. So let's see, my mom was in the low 40s. I had around 15,000 IU a day plus K2. If you're going to do high dose vitamin D, you got to have K2. We did go through Thorn. October 24, it was 105. So I dropped her down to, I think it was 5,000, because the pills, Thorn has 5,000 IU and 1,000 IU, and they look exactly the same. It's actually a little annoying. The bottles and the pills look exactly the same. So she says she was taking 5,000. I thought she was taking 3 1,000s, but so she was at 105. So I dropped her down and then had her go again. It was 125. So I dropped her down to 1,000. I thought I did, but then she looks at her pills and she's like, no, these are 5,000. I'm like, no, Mom, you gotta like, no, like, so we gotta go get that looked at. Like, you gotta just stop taking it. Like, so that's an example of like, hey, we're trying to do the right thing. We try and talk about this, but like, this is a lot. It's hard. We do the best we can. She's still alive. She's still fine. But yeah, you can go above 100 and the world doesn't cease to spin. She doesn't have any side effects. She doesn't like, we don't need to freak out about it. Here's again, the liver. So here's the new mix of antiparasitics. So your AST and your ALK, or sorry, AST and ALT. Again, to me, indicate liver function. You can see I kind of dropped off the wagon here with my notes, but yeah, so she was high, and then dropped down, and then had this one blip. And this is where like, okay, well, they do look at her labs because they're like, why are your liver so high? Like, don't worry about it. We'll fix it. Because they actually called her and like, why are your liver labs? I was like, well, we need to make a change. So I paused that one particular antiparasitic. It dropped back down, and then it was fine. ALK phosphatase. Someone please tell me what that means. I didn't look it up. Let's see. ALT. Okay, again, same thing. So your ALT and your AST are liver metrics. She's fine. I don't really worry about it. CO2. This is the hilarious part. When she asked her provider, she says, what is CO2? Like, what does that mean? Right? Because she'd be up and down. She's like, what? I'm high. Like, oh, well, CO2 measures the amount of CO2 in your blood. Oh, thank you. Thank you so much. I had no idea. I just facepalm every time. Anyways, but the internet says that it measures the amount of bicarbonate in the blood, which is crucial for maintaining the body's acid-base balance. So, like, higher CO2 means that your blood is more acidic. So that, of course, is concerning me. I want her to maintain pH. I want her to be more neutral. So what caused that? I don't know. But they couldn't tell us, and they have no idea. So I don't even know why we bothered to ask, except that now I know they don't know either. Okay, anion gap is a general indicator of pH. So if it's an indicator of pH, then I feel like those two should match, but they don't. And again, here we have this roller coaster thing. Why the roller coaster? I don't know, but it's all in normal, so I'm not going to worry about it too much. But high anion gap indicates acidosis. You're too acidic. Lactic acid, that could be lactic acid or ketones. Oh, maybe that was it because she was fasting. Oh, maybe that was from fasting, if it was ketones. Huh. Okay, maybe. Low anion gap is caused by low albumin. Here, I even have a phonetic. Albumin. Okay, so we can all sound intelligent. Okay, so in a nutshell, those are the labs. I'm at the point now. Again, the oncologist is happy with it, but I still monitor, and I still try and look for different things. So the biggest point right now is like, okay, are we generally stable? If things are kind of trending downward or turning upward, that's grounds to like look into it further. And then now, okay, if we're going to drop to 450, from 600 to 450, we're going to see what that does for a month or two and then reevaluate from there. Because the problem with Lynparza, the brain fog, the neuropathy, I had to change her lion's mane. I had to change, she's on the R-alpha lipoic acid for the neuropathy. Like, it wasn't keeping up. And you can see here, we're just, some of the things that worked during Frontline they're just not keeping up. So that to me is indicating that just Lynparza is just more toxic. The fatigue is way worse. So we're looking at ways to I say find the right balance for her. They told her that they don't do any weight-based assessments for Lynparza, which blows my mind. We don't understand how her liver metabolizes things beyond these labs. But and THFR, how is she metabolizing these? And that should indicate, I don't know, that should inform dosage. But they don't care. The studies show 600 milligrams. So that's what we go with, regardless of again, no judgment. If you're 300 pounds, you get 600 milligrams of Lynparza. If you're 125 pounds, then you get 600 milligrams of Lynparza. That just blows my mind. I can't make sense of it. And the side effects are just wearing on her. So we're going to try something else and monitor and go from there. So as always, please tell me what I missed. Please tell me if you have experiences that match this or if they're different. That would be great. I would love to hear what you have to say. Again, this is just, this is how I read labs. This is what it means to me. And this is generally what we've done as it relates to these labs specifically, and mitigating some of the effects of chemo in what I feel are a healthy and safe way. That is what we've done. So I love you guys, and I hope you have a wonderful day. Let me know if you have any questions, and we'll see if we can help each other learn. Okay, bye now.